Joy is a 2-year-old girl, happy and the apple of her parents' eye. But very unfortunately, she's also seriously ill. And Joy's parents have been awaiting open-heart surgery for their daughter. But even after a meeting with the Health Minister, Mary Harney, yesterday, they're no closer to knowing when it will happen. And Joy's mother, Gemma Lawler, joins me now on the line. Good morning to you, Gemma.
Good morning, Claire. How are you?
I'm very well. How's Joy?
She's not too bad. She's just woken up. She's in relatively good form the last week or so, but she's still having the spells where she goes, she loses colour in her face and she goes a bit blue and just goes very quiet for those few minutes, which can be terrifying, really.
And she was recently, you were recently taught CPR skills, is that correct?
Yes,
at Crumlin?
The week before last we were called into Crumlin Hospital to learn CPR for children her age, just in case we need to use it.
And tell me about her condition then, and how ill she is, or what you've been told.
Joy was born with heart defects. One of them called an ASD, it's a hole in the heart, a very large hole in the heart, and the other one is called pulmonary stenosis, where the aorta coming out of the heart is too narrow. They were sure really from the beginning that it would need surgical intervention to close the hole so that she could have a long and healthy life. But there is an optimum time when that surgery needs to take place. And if it doesn't take place within that time, the heart starts to be damaged by the pressure that it's been put under because it's an inefficient pump as it's working at the moment. And that damage was visible from the clinical assessment she had in September.
Right, so she needed the operation pretty much there and
before
then.
September, yeah.
And what have you been told?
We've been told that she is on a waiting list for open heart surgery. In September, we were told they had hoped that they would have her done within weeks. Definitely, she should have been done before Christmas. When we were up there the last time, we were told, well, they hoped that they may get her done before Christmas. But there are 30 children who are, as they say, out the window with regard to the need for surgery.
Is she amongst the 30 then?
Pardon?
Is she amongst the 30 on that?
She'd be just below the surgery because
Okay.
she's not critically ill all the time, but she just has these spells where she needs, which are very much of concern. But there are children who are critically ill all the time, who are out the window with regard to needing surgery. Okay,
now Mary Harney, you've been in touch with Mary Harney, and I know that your husband Mark met Mary Harney yesterday. Did anything come of that meeting?
Well, Mark tells me that it was a very good meeting. It lasted about 40 minutes. He was appreciative of the time that she allowed. But what the minister seemed to be saying was that it's a myriad of problems, including, HSE, hospital management, the City of Dublin Hospitals Confederation management. It's a more complex issue than we think it is. In my personal opinion, it's a very simple issue. And when a child's health and life is in danger, I think it becomes even more simple and needs to be prioritised and fixed. When I started to look into this about 6 weeks ago, I spoke with her surgeons, I spoke with the nurses, I spoke with other people in the situation, and it is a very fixable problem that is happening in Crumlin. Basically, the ICU department is inadequate, but it is not working at optimum level. It's not working at 100% every day of the week. Now, I think that's definitely fixable. One of the problems seems to be the staffing of ICU and the moratorium on replacing staff who are out on leave. That problem is not being addressed. Apparently, there is a proposal with the HSE and the Dublin hospitals to rectify that. But as yet, the minister and the public have heard nothing about whether that's going to happen or not. So that would definitely alleviate the problem.
And in the meantime, you've got this worry that you go to bed with every night and that you wake up with every morning, and the frustration must be incredible.
It's incredible, but I mean, this is just the start of the journey for us. If we were further along the journey, we could have been called into hospital for Sunday evening. Joy would have been called in on Thursday to have cross-matching of her bloods done, so she'd have to go in, have bloods taken, and have all her tests, go home. On Sunday, go into hospital, be scheduled for surgery Monday morning. And the likelihood is she'd be fasting for the night before. She'd get to Monday morning, go up towards lunchtime, maybe 1, 2 o'clock in the afternoon, be told, oh, sorry, we can't start the surgery because there's no ICU beds. Go home and wait for a letter.
And you've met people in Crumlin who've been through that experience.
Nearly every person I have met in Crumlin and through this campaign has told me that this has happened to them on average 3 times.
That the child has been prepped and sent home.
And the family, this is not going in to get a tooth out. This is open heart surgery. And to prep yourself as a mother and as a father to allow this to happen to your child, to prep the child who knows what hospital is about, and to go in and go through all of that and be told, oh, sorry, no, we can't do it today, wait for a letter.
We're getting people who are getting in touch with us this morning, Gemma, offering financial assistance. But is this a financial matter? I mean, would money sort this out?
I'd love to think so. I don't think that it will shorten the waiting list because from what I have learned, it's to do with staff salaries. And as a public, we cannot fundraise to pay the salaries of nurses, for example. But at the same time, we are trying to raise money to make the waiting a little bit more easy. I know that's not the right word, but a little bit more palatable for those patients and their families who are suffering terribly at the moment, the stresses of all this.
What about, Gemma, going abroad and having the operation done?
Apparently that may become a possibility. If these children become critically ill, they will have to send them abroad as opposed to allowing a fatality.
Would you do that with Joy?
I would prefer not to because obviously we have a bond with her medical team. We've seen them every month or 3 months since her condition was diagnosed. And we trust the medical staff in Crumlin, and we're happy to be with them. To go abroad is a huge leap of faith, and it's something I suppose we don't really want to look at that. Because, you're going to a different country, you're going to a different culture, you're not too sure what the situation is, and then you look at the finances of it all. Will our healthcare, our private healthcare pay for it, or will it not? Do we have to go to the States? We also know that the surgical team in Crumlin is the best in the world.
You just can't get access to them.
We prefer our child to be, treated at home in her, in her country with her family and friends around her. But obviously, if we have to do that, we will look into that. But I mean, what happens to the other children? This campaign is about the list.
Yeah, I was just going to ask you about that. I mean, you've launched this campaign, and I know you're devoting a lot of energy to it. And the website is savejoy.org if people want to check it out and print out the poster and display it and so on. But what about the other children, Gemma? Because there are some who might say, are you asking that Joy jump the list and that
absolutely and categorically not. This is about the waiting list. We want the waiting list to be reduced. And when we say save Joy, we don't mean joy as in our daughter. We mean as in joy and hope and happiness for every family that has a small child waiting critical surgery. Every family is entitled to the joy of knowing that their child has a right to a long and healthy life. And this is being held up. This joy is being taken away from families. And in places, they're going through torture at the moment. So when we say save joy, this will actually save money. It will save joy. It will save peace in people's lives. And it's totally rectifiable. And I know the country is in a desperate state for money at the moment. But, by rectifying this problem in ICU, it's going to be saving money in the short term, medium term and long term. But it also will be saving joy for all those families who are in a desperate situation at the moment.
All right,
so it's
Gemma.
not about our daughter. And I think people know very clearly, people who know me, that I will absolutely resist any attempt to put her ahead of any child who needs surgery more than she does.
Gemma, well, thank you for talking to us, and we wish you and Mark well, and of course Joy, 2-year-old Joy, waiting for open heart surgery. Again, the website, if you want to support Joy and her family and all of those who are waiting for surgery, all of the children who need surgery and need it urgently, is savejoy.org.